Today's webinar is called Excel, Exercise for Cancer to Enhance Living Well. This presentation is being presented by Dr. Nicole Koulos-Reed. She is a professor in health and exercise psychology and the Associate Dean Graduate in the Faculty of Kinesiology and an Associate Professor in the Department of Oncology, Cummings School of Medicine at the University of Calgary. She also holds a Research Associate appointment with the Department of Psychosocial Resources, Tom Baker Cancer Center, Cancer Care, Alberta Health Services. As a behavior change expert, Dr. Koulos-Reed's work utilizes a multidisciplinary perspective to build, disseminate, and implement programs to integrate wellness into standard cancer care. Using an implementation science approach, her team develops sustainable physical activity programs that are delivered in real-world settings. These exercise oncology programs are designed to positively impact the physical and psychosocial well-being of cancer survivors, ultimately enhancing the quality of life of individuals living with cancer. In this presentation, you will learn about the role of exercise in the cancer care pathway and the potential benefits from building a habit of moving more. We will also discuss the Excel study, Exercise for Cancer to Enhance Living Well, and how it is providing a sustainable exercise and behavior change program to those living with cancer in rural and remote regions across Canada. You will learn what is involved in this exercise research program and how to get involved online now. At the end of the presentation, our speaker will be able to answer your questions. However, at any time during the presentation, feel free to submit your questions in the question box in your control panel. This webinar is being recorded and the recording will be available on YouTube. In addition, the slides will be available on SlideShare. Links to both will be sent to the email you provided. Now, without further ado, I will turn things over to our presenter. Welcome, Dr. Nicole Koulos-Reed.
Thanks very much, Leila. Yeah, perfect. Thank you. So before I begin, I simply want to acknowledge that no matter where we are in Canada, we are seated on traditional First Nations lands. In Calgary, we are on the traditional territories of the Blackfoot people of the Treaty 7 region in southern Alberta. Next slide, please. We also would like to acknowledge that the project you're going to hear about today, Project Excel, champions equity, diversity, inclusivity within our team, our research questions, the training, the programming, and the development of resources. Next slide, please. So just to get us situated, I'm going to give a brief background on the role of physical activity, movement, or exercise for individuals living with cancer. I will describe Project Excel, an overview of our newest funded project, which is really aiming to get movement resources to individuals across Canada, and then talk specifically about the exercise program itself and the unique way right now we're delivering it due to the pandemic. Next slide, please. So just for a little bit of background, speaking around cancer as management of a chronic disease, and you can see some of the numbers on the screen here. But what I really want to highlight is that there is a growing number of individuals living with cancer or cancer survivors. And because of that, we really have to start to consider more, how do we build wellness as part of this cancer journey and not wait until years after people are finished going through cancer and its treatments, but really as soon as possible, can we build in wellness, and from our perspective, wellness using movement, physical activity, or exercise to really have people take back control, enhance their quality of life, and live well with cancer. Next slide, please. So across the board, our statistics really do highlight that provision of supportive cancer care services is required to address both immediate effects of cancer and its treatments, as well as long-term effects that we often see. So things like cancer-related fatigue, soreness, muscle myalgias or arthalgias, overall functioning, and I think really what has been brought to the forefront during this pandemic is the impact on mental health and overall well-being and quality of life. Next slide, please. So I'm going to be speaking today really around the role of physical activity as a tool for wellness and to enhance overall physical and mental well-being and quality of life in individuals living with cancer. Next slide. So a few key terms you'll hear me using today. So cancer survivor or individual living with cancer, meaning from the point of diagnosis onward, so on or off treatment. And then the three terms I've been using already: physical activity, exercise, and movement. So right away, I want to dismiss the notion really that this has to be about going to the gym. for most of us right now, we can't go to the gym. And so we really want to focus on this idea of, can you move more? How do you integrate more movement into your usual day so that we can reduce some sedentary behavior, which we know has gone up over the last year with the pandemic, and really promoting this idea of engaging in physical activity throughout your day, whether that's getting out for a walk, whether it's up and down the stairs in your house, whether if you're in Alberta and it's shoveling snow. All of those movement pieces count, and they really do enhance overall well-being from both physical and mental perspectives. Next slide, please. Really important is that what I'm going to be speaking about today is evidence-based. And so we have years of research showing that exercise, so structured physical activity, is very safe and beneficial for all cancer survivors across the continuum. So this is from pre-treatment, using exercise as prehabilitation, so people can be more able to engage in full treatment protocols, as an example, get them mentally and physically well and ready to function as they move through treatment, all the way through to the other end and looking at exercise and cancer survivorship. And in particular, a growing area of work in exercise for individuals who will be living with cancer, advanced cancer care. And so they know with more advanced cancers, there may not be treatments that result in going into remission. So they're living with cancer. And we have a really unique opportunity as treatments have improved to address quality of life for this population that are living with cancer. Next slide. Across the literature, we see a number of benefits, and I think oftentimes you think about exercise provides physical benefits or fitness benefits, which it absolutely does, and it does so even in individuals who are managing or living with cancer. But really important to highlight that exercise in cancer can also address issues of a mental or emotional well-being, depression, anxiety, low quality of life. We know we can enhance that using physical activity and movement. And then really for some of the cancer related specific side effects, so lymphedema, poor bone health, and the #1 reported negative side effect across all cancer types is cancer-related fatigue. Next slide. So this is a unique symptom of cancer and its treatments. And what I think is really unique about it is that we don't have just a standard treatment for cancer-related fatigue. So unlike some things like nausea or pain, there may be pills or medication that can be given. And yet we know from the evidence base that while many individuals will report this, very few healthcare providers report being able to treat it effectively or addressing it. And that's because it doesn't just have a drug or a therapy that can be given. In 2018, I was part of a team that really looked at the evidence for physical activity across all cancer types and populations. And what we found is that evidence suggests that physical activity is our #1 evidence-based tool to reduce fatigue severity. And it didn't really matter which patient population, so it works for breast cancer, colorectal, lung, mixed populations, prostate, etc. And it also doesn't really matter what levels of physical activity, it's just people doing something. So it doesn't have to be that you have to be walking or on a bike or swimming, right? Different types of movement all worked. There seems to be a bit of a dose response, so we start to see benefits for cancer-related fatigue when people are engaging in it regularly. And that's really the take-home message. You can't do it just once in a while and expect the full-on benefits. But we saw benefits in programs that were 4 weeks, 6 weeks, 8 weeks, 12 weeks, and even those that were longer. Okay, so it really is our #1 evidence-based tool to help individuals manage this very distressing symptom and a symptom that really negatively impacts quality of life. Next slide. So just a quick take home on this. We have a lot of benefits of exercise, and really one of the key messages is that for the most part, if we screen and triage people appropriately, so we adjust the exercise to where they are, there aren't significant negative impacts. So exercise is safe, there's no risk. It's unlike any other treatment where you typically have a litany of potential negative side effects. The side effects of exercise are all positive. The differences in how we use it can really depend on where through the cancer treatment journey and afterwards an individual is. So when people are undergoing treatment, we're typically not using exercise to try to get big fitness gains. We're using it to help them manage and alleviate the usual decline that may happen. It's really after treatment, as the body naturally starts to recover, that we may use exercise more as a tool to enhance things, to enhance fitness, function, and well-being. Next slide. Based on all of this evidence, we have exercise guidelines specific for individuals living with cancer. And the latest version of these guidelines, slightly updated, came out in 2019. Next slide. These guidelines cover our 3 basic areas of fitness. So there are aerobic guidelines, so that's anything where you are moving, increasing your breath, increasing your heart rate, so it works on your cardiovascular system. And you can see there the guidelines say get 90 minutes of moderate intensity aerobic exercise per week, or slightly less if you're getting vigorous. So what does that even mean, moderate and vigorous? So I always tell people it's like if you're late for an appointment and you're walking briskly across that parking lot or up those stairs. That really gets at that moderate level. Now, really important, and I'll highlight this right now, and as I go through, you can do aerobic exercise at a mild level. So what about if you're, just diagnosed and you just want to get out for some walks? A light walk can still provide benefits, even if it doesn't reach what these guidelines suggest at moderate levels. The second component of fitness is for strength gains. And in certain cancer types in particular, we see that additive benefit of adding resistance types of activities, and that can be your own body weight. It can be adding in bands or light weights. It can be using machines, right? But anything where you are working your muscles, building strength, the recommendations are just 2 days a week. And so that's 2 days a week, really tailoring and targeting different muscle groups. And then the last piece is stretching, flexibility. And having taught fitness for years, I will say this is the piece most people tend to ignore, right? They get their workout in and then shower and go. They don't do the stretching. And I always tell individuals, really scan on a daily basis, multiple times a day, from the top of the head to the tip of the toes. And that can give you a nice idea of where are you holding your stress. Flexibility is so important so that we can maintain our ideal range of motion. We can move our arms and our legs, stretch out through our back so that we can engage in our activities of daily living. So these are the general recommendations, and then they come with a few more guidelines. Next slide. And these guidelines, what I really want to highlight is the last point. Okay, so you may take a look at these guidelines, and if you've just been diagnosed or you've gone through treatment or you're dealing with other comorbidities, or you've just never been somebody who moves regularly, they can be quite intimidating, right? Starting right off, getting 90 minutes, getting some resistance training when you don't really know what's safe or effective. And so the actual guidelines gave you the general recommendation, but then it's number 3, individualizing and tailoring. And that really should be built upon your health status and your fitness status, and then your experience with physical activity or other comorbidities that you may be managing. Really important that you're not going to get the benefits if you just look at those general guidelines and they don't work for you, so then you don't do it. Some individuals might start out with 5 minutes a day of movement and then just build that up over time as they feel more confident and in control. The guidelines also do state, though, that after treatment, exercise is essential. So it shouldn't be something that's an extra. It shouldn't be something that, the healthcare system isn't paying attention to. We have enough evidence to really suggest that this is an effective tool to enhance wellness throughout the cancer journey. Next slide, please. So based on all this evidence, we've been doing work here in Alberta and now with our colleagues across the country to ensure we can get these resources to individuals living with cancer. And so the grant I'm going to talk to you about today is called EXCEL, Exercise for Cancer to Enhance Living Well. It's been funded by the Canadian Cancer Society, Canadian Institutes of Health Research, and here in Alberta with additional funding support provided by the Alberta Cancer Foundation. Next slide. Our project team across the country includes a whole host of researchers, clinicians, community partners, and advocates. I'll just highlight our core team of co-principal investigators is myself here at the University of Calgary, Daniel Santamina at the University of Toronto, Margie McNeely at the University of Alberta, and Melanie Keats at Dalhousie University. Next slide. Along with those PIs, our core team includes Ms. Juliana Dreger, who's a clinical exercise physiologist and research coordinator. So she's kind of overseeing all of the logistics for the team across the country. And then we have clinical exercise physiologists, which, as you'll see, they're really the secret sauce, the ingredient that we need to build exercise into standard cancer care. They are the level of fitness professional that can screen, and prescribe exercise effectively to help manage the symptoms, side effects, and enhance well-being in cancer survivors. And so you can see, along with the core PI team, we've got CEPs at each site that will help really build this program outwards. Next slide. So Excel doesn't come just kind of out of the blue. Over the past 5 years, we've been building a program in Alberta called ACE, Alberta Cancer Exercise. And this program is just coming up to the end of its funding this spring. And it is the basis for Excel. So we are taking our same exercise model with some tweaks enforced by the pandemic and also to adjust for moving across the country to really implement exercise in community-based settings. And that's what's unique about these projects. This isn't us in a tightly controlled research environment, just building it and studying the outcomes. It is really, how do we take the best evidence and take that into communities so that they can deliver exercise to individuals who need it, to those living there with cancer. Next slide. So the objectives of Excel are to really improve the access to exercise programs for those living with cancer across rural, remote locations across Canada. So it takes it outside of Alberta, outside of really our major urban centers where most of the research is done, to individuals living wherever they are. The goal with Excel is to really result in improving physical activity levels as reported by our participants, but also we have some objective tracking measures. We're sticking some accelerometers on people. So we'll have both objective and self-report measures of physical activity. And then ultimately our goal is to build exercise in as part of standard cancer care. We have the evidence. We know exercise is good for individuals. It's good for all of us. And when you're managing cancer, it can really help with symptom side effects and to enhance that sense of control and that idea of wellness in the illness journey. Next slide, please. To do this, to build this out effectively, we've developed this exercise oncology survivorship model, which has these 4 components that I'm going to talk about. But very briefly, based on our core team of knowledge and expertise, we have this hub and spoke framework. We really rely on this clinic to community system. So making sure individuals, starting with healthcare providers and then the patients in the system, are informed when they're in the system, and then building that out to how do we support them in the community and that network of fitness professionals, which is point 3, training those fitness professionals to work really effectively in an exercise oncology program. And then it's delivering this program, and as you'll see, uniquely during the pandemic, because everything now is online. Next slide. So just a little bit more detail on each of these components. The first is this hub and spoke model. And so this really relies on most of the exercise oncology research has typically been done in our major urban centers with academic work research. And so we've taken that and said, okay, we've got our central team with expertise and support. And now we're going to, in our surrounding communities, really develop the expertise through our QEPs, which stands for Qualified Exercise Professional. And so we build this network of those are the people that are going to be delivering the programs. They're the ones who are going to be working with the individuals with cancer to provide exercise as a resource. And then they've got the central team for support. So everything we develop as part of the program, they get the training on. We have a feedback loop back and forth to ensure that they can tailor and tweak it to the unique needs of the individuals they're serving. Next slide. This really then is what this looks like across Canada. So the darker circles are where, you know, most of our core team and PIs are, and you can see then the outreach that will happen from that. We've also, just so you can note on this map here, we've started outreach in Quebec, which relies on French translation of all of our resources. So we're excited to see that happen. And a lot of this is already happening, even though some of the spread wasn't supposed to happen until later on in years 2 and 3. Because of the online nature right now, we're starting to really expand the scope of having those spoke sites cover more of our provinces. So we look forward to really seeing this map become more well covered over the 5 years of this program funding. Next slide, please. So what actually happens in this kind of hub and spoke model is built on this idea of a clinic to community framework. And it's really recruitment into the Excel program, which is facilitated by connecting with the communities where we see individuals with cancer. So number 1, our cancer centers across Canada, and then different networks such as the 3CTN, which is around clinical trial development, and then branching out beyond cancer, because in many of our small communities, there isn't a community cancer center. So using primary care networks and family physicians. That's one side, the healthcare provider side really of our networks. And then the second side is really with our fitness and recreation centers. That's how we'll build awareness in their communities that there's exercise-specific programming available for cancer survivors, and where we really build that network of trained professionals. And then finally, it's reaching out directly to the groups that support cancer survivors. So support groups, networks like the one we're talking to today, the Canadian Cancer Survivor Network, and others, to advocate and to increase awareness of these resources that are available out there. Next slide. So this clinic to community model really relies on building this referral and recruitment network. So for Excel, we're really targeting patients, cancer survivors that live in remote and rural areas. You can see here the criteria. It's for any and all cancer survivors. Within 3 years of treatment completion, however, individuals can receive a doctor's physician's note to say they're still dealing. It might be 5 or 7 years later or even longer, and that exercise would be beneficial for them. So we really are wide open to taking participants into the program. Right now, access to reliable internet is a big component, so we have to be able to have them join our online programs. So patients can self-refer, which is great. In order to really build awareness and have systematic delivery of this program, our goal is to build in this referral directly from clinic to the community. So healthcare providers can absolutely refer direct patients directly to our resources. As soon as they come to us, we have this onboarding process where our exercise physiologists screen and triage individuals so we can make sure they're going into programs that will address their needs. Next slide. This onboarding process really takes people from their referral, whether it's from themselves or their physician, and engages in that screening. So the hub site clinical exercise physiologists will assess individuals. So we do a baseline physical activity assessment, as well as have them report on their patient-reported outcomes, and then they can come into the exercise class. For other individuals, so they may be on treatment, they may have additional concerns, we may require medical clearance. And so we will go back for them to their referring physician or to wherever they're being treatment, get that clearance provided before they would then come in, have the same assessment done. And it's really important to note that as part of this implementation study, we're also studying the effectiveness. And a big piece of that is we need to be able to assess individuals when they come in for a couple reasons. One, it's safety. So we need to make sure that they can engage in all these movements that we're going to have them do in the class. But even more relevant really from the participant's perspective is we want to be able to show them change. And so when we do a fitness assessment at the beginning, that's all done online, then at the end of the 12-week program, they get the other assessment and they get that result of showing where have they improved and where is there still room for maybe some more improvement. Next slide, please. So all of this implementation really relies upon the development of this the Qualified Exercise Professional Network. And that is taking fitness professionals who already exist out in the community. So they're the ones teaching at your community centers, delivering programs when we were in person to your classes through your fitness facilities, personal trainers, and it's giving them specific training in exercise oncology. So that's really our first step for those that are interested, that want to deliver this in their community, is we want them to be trained to ensure they can deliver our program safely and effectively. And then that training continues on as they go on this journey really with us. So there's on-the-job training where they start off not leading classes, but working with our fitness professionals who've been leading classes since the start of the pandemic online, and gives them moderating roles so they can see how this is done. And then they gradually do more and more of the leadership role, getting that feedback from somebody with more experience. And we find that this is really giving us the opportunity to ensure that they feel confident delivering the program to the group of participants, and it ensures that they're going to be delivering the program really that we've developed, which I'll show you in just a minute here. And then in addition to those components of their kind of on-the-job training, we have ongoing monthly webinars that can be delivered by our hub sites to provide them more information and education on how to support and really build that positive motivational climate that will facilitate our participants being effective and successful at changing their behavior, at increasing their physical activity. Next slide. So the crux of what we're doing, the actual exercise oncology program, As I mentioned at the beginning, this is the exact same program that we've been delivering in 5 years in Alberta. So it is evidence-based. We know it works. We know it can provide the potential benefits, and we know it's safe. And there's a number of components to it. So it starts, as I said, with those assessments at baseline before they come in, at the end of the program, and then we have 2 follow-up assessments, because we're not just interested in getting people to change and do our little program. We want to help them build the habit of being a regular exerciser who sees themselves as someone who's going to just build this in as part of their lifestyle. So it's really important for us that we have follow-ups up to a year to see what are people still doing. Did we support them enough to make that effective change? Along with our fitness assessments, they fill out questionnaires around their activity levels, around their quality of life, and indices of emotional well-being. And then we have objective measures of physical activity. As I mentioned at the beginning, we have accelerometers, so we actually will get a objective measure, potentially, hopefully pretty good, of the actual movement they're doing, not just in our class, but in everyday activity as well. Everything right now is assessed online because of the pandemic. So normally we would have community locations and people coming to them and getting assessments and then enjoying the classes. Right now, all of that enjoyment is online. So individual assessments and then group-based delivery of the class. Next slide. So what the class actually looks like in the program, in our Excel model, it can be an 8-week or a 12-week program. We try to get everybody into 12-week, but we also try to accommodate individuals who may have learned about it late and still want to come in and not have to wait another 12 weeks. The program itself is 2 classes per week. Each of them is an hour long. And then we build in kind of a pre-post time, and mostly post for 15 minutes kind of post-class social. That would naturally happen in a community environment, and so we're really trying to facilitate that by having that opportunity online for individuals to meet and to chat and just to get to know each other. The program itself is multimodal, so we really give a variety of cardiovascular, resistance training, balance, and flexibility exercises. And it's all stuff they can do at home, so no equipment needed. If they have, like you see in this picture, little hand weights or bands, they're given options to use things. But it's really important to note that really all individuals need is that internet access, because it's delivered on the Zoom platform, and a space to move, just a little bit of space to put their arms out, to go back and forth a little bit. That's all they really need. This program, even though it's delivered in a group-based format, it is really tailored to the individuals, and that's part of why we do that baseline assessment. The idea of Excel, as it was with ACE, is to really meet individuals where they're at and create a safe, inclusive, and really positive and motivating class environment that supports people to learn these new skills and build that habit of moving more. Next slide. So as I mentioned, the actual exercise program is on the Zoom platform. It has a leader, so there's one person leading the group, but it also has a moderator, and that's a huge part of our safety precaution for doing this online. So the moderator, while the fitness leader is leading, they can watch on the screens. They can help individuals if there's a need for some individuals to receive more feedback or make adjustments so they can address those things. The other piece that the moderator has is actually the physical addresses of where everybody is, so that if there ever is an adverse event, we know where to direct help to. And then, of course, we really do rely on having that stable internet, which is, we know, going to be one of our biggest barriers long-term, looking into more rural and remote communities, because that can be expensive if they can access it, and in some cases simply can't access it. We also, because we're doing this online format, have developed a number of resources, toolkits, and provide additional support for those who aren't familiar and need help getting set up. So we really hope we're addressing that potential barrier and giving all the support that is required to have people join in and feel confident joining in for these classes. Next slide. So in addition to providing that kind of 2 classes a week with focus on the actual movement, the exercise prescription, we're really interested in supporting behavior change. And so along with the program, we have additional education topics which are delivered just in class, as well as additional webinars. And so this is a whole host of different programs to really support, again, people developing the habit of exercise and increasing their confidence. And I'll go through those topics in just a second. the last piece I just want to highlight as something to further support their behavior change is we're integrating an app called Zoe Insights into the program. And this is an app that's been developed by a cancer caregiver whose wife went through the experience, and it was really born out of some of their frustrations of tracking what different things they were trying in wellness and medical appointments. And so we're using this app to really track physical activity and what's associated with that for individuals. So are they feeling more energized, less fatigue? Are they motivated or not? Do they feel more well or not? And so using this app, we hope can give people some of that more immediate feedback on how do they feel pre-post class and over the course of a week when they're moving versus when they're maybe not moving. Next slide, please. So those are two of the pieces, specifically a bit more information around the education we build into the program, as well as in the extra webinars. You can see the topics here. So we cover some of the basics around the role of exercise for cancer survivors, and then really get more into some of the behavior change tools. So how to set really good goals that can be motivating, addressing issues around relapse prevention and motivation. So how do you keep going? It might be fun at first, and then, you know, oh, is it still fun? How do we make sure that we are addressing barriers and can keep people on task? And then some of the other big pieces, we know cancer-related fatigue again is a big issue, as is stress management, and this has really just been amplified through the pandemic. And so specific topic around that. And then finally, the value of social support. So we've built this as a group program for a reason, and that's because we know when people can connect with others and gain support, it can really enforce long-term motivation and long-term exercise adherence. And so we really want to tap into that, whether it's the support they get from the group or just recognizing where they can build the support in the other areas of their life. Really critical for us and for understanding exercise long-term and keeping people going. The webinars that we provide are really designed to have an interactive component as well. So there's small group discussion with moderators there to really get participants' feedback and to understand what works and doesn't work for them, so that we can continually improve and ensure we're giving valuable information that is going to support behavior change to all of our participants. Next slide, please. And so we use these webinars as really an opportunity to further foster community. Again, when we're in the community setting, when we're in person prior to the pandemic, a lot of this just happens, right? People end up talking and going for tea together, and we're so looking forward to when we can safely do that again. But right now we're focused on, well, how do we build that same sense of community, and using the breakout rooms, having the time to chat and connect with others and recognize that many individuals experience the same thing, or some people have had different ways of dealing with it that might be effective. Being able to share that can be very empowering. And so one of the quotes from one of our participants about the webinars talked about it giving them permission to focus on themselves. And for some, this may be the only conversation all week, or the only really chance to focus on what they're doing really around wellness for themselves and something positive. So I think we're seeing a really important piece and a nice sense of community that we can build through these webinars. Next slide, please. So where we're at right now, we have our next round of Excel programming starting this spring. So Excel officially started last fall, September 2020, and then our second group started winter 2021. We have active hubs up and running in Calgary, Edmonton, Halifax, and Toronto. But because of the online nature, right now we are taking participants from wherever they are interested and across Canada. Again, we're really trying to focus on rural remote. Where there are urban resources, we're redirecting people to those. But if they don't work for them, if they don't have something they can access, we're more than able to have them come in and join our online programming as well. Next slide, please. We're continually working outwards as to where we're going next. So as I mentioned, we have interested collaborators and expertise in Quebec. So we're hopeful that we'll be working on French translation and our ability to really do some significant outreach through Quebec. We're also working on co-creation with Indigenous partners around what a community oncology program may look like for them that focuses on really traditional ways of movement for their participants. And then we have some work really looking into the underserved ethnic minority populations. So typically across the exercise oncology programming literature, we see primarily Caucasian participants. And that's often because English speaking and being able to complete the forms in English is one of our criteria for coming into those studies. And so we're doing some work to see what we can do and what resources we can provide to remove that English as a language barrier and engage more individuals in these resources. Next slide. There's also a unique opportunity right now to outreach to our AYA populations, adolescent and young adult. So we've started this with a yoga specific program, and we're going to be building yoga as a resource across our exercise programming as well in general for everybody. But we piloted this, started last spring, and then ran a second pilot this fall. And really excited to see the interest and the engagement on this, where I think right now we have over 60 participants from across Canada joining in this programming. And so current programming is on running. We'll hopefully have one more 8-week program through the spring. And again, we're taking the same measures that are in Excel and looking at the benefits of this as a program to connect this population, the adolescent and young adults in particular. Next slide. So there's a lot of research that's embedded into this hybrid. It's called an implementation effectiveness study. So we're really focused on building the resources that are evidence-based that we can put into and provide access to for individuals no matter where they live across Canada. There's a really important piece of this is gathering feedback from our relevant stakeholder groups. So our networks include those qualified exercise professionals, our clinical healthcare provider partners, and then our community partners, including our participants and others in administration, for example, in healthcare systems. The participant feedback in particular is really important for us because it covers all aspects of the actual 12 weeks of programming plus the resources, additional resources and the research components. So we're getting feedback constantly built into implementation of the study to improve the content, to improve the delivery, update any resources, and really importantly, how do we need to tailor it for different communities? So already, for example, with the AYA, we see different needs and what they might want in terms of interactions with others than in some of our other programs. We can take all of that information and use it to track how we make changes so that we're always delivering not just a standardized program, but tailoring it so we can deliver the most beneficial and impactful program possible. Next slide, please. Part of the quality improvement cycle really comes from asking individuals about their experience, and we call this My Excel Story. We did the same thing with our ACE participants, where they can just tell us in their own words what has the program meant for them. So I'll just show you on the next slide, please, what one participant or two participants had to say about the Excel program. So living in a rural location, the Excel program has provided a lifeline for me. The benefits in exercise and cancer recovery are well documented, and the network of support is an added benefit. I truly believe that is making a difference for all of us cancer survivors. And then the other participant said, I hope to see this study offered as a permanent program to all Canadian cancer patients, as it has made a world of difference for me. So as you can tell from just these two testimonials, we see significant impact of individuals being able to access this, and particularly being able to access it when we're really restricted for a lot of us, and for maybe individuals who are going through cancer treatment even more so, access to the usual support and resources they may have had in their community. So it truly is providing a really necessary wellness resource and lifeline for individuals to support them and to ensure that they can really enhance their well-being and their quality of life as they move through this journey. Next slide, please. So with that, on behalf of our team and Juliana, who is on the call today as well, I'd just like to thank you for attending. Our contact information is there. For anything around Excel or ACE in Alberta, please feel free to contact us at wellnesslab@ucalgary.ca. Thank you. The next slide has the Canadian Cancer Survivor Network information as well.
Thank you, Dr. Nicole Coles-Reid, for that presentation. We have some time left for questions, and we have quite a few of them in the chat right now. So if you haven't had a chance to submit your questions, please make sure you do so that hopefully we can answer them. So first question we have here, At the end of my treatment, I had tachycardia and my CT scan showed I have mitral valve prolapse. Was told I could exercise and that they would keep an eye on it. It scares me now to push myself. Everything is harder and I tire so easily. What do you suggest I do to feel more comfortable, especially during COVID, as I don't want to put myself out there and need to go to the hospital?
Yeah, that's a really good question and really speaks to the need of that coordination from the healthcare provider to that qualified exercise professional to ensure that anything that participant would engage in would be first and foremost safe. So I can't, not knowing all the specifics, provide any specific prescription. But the general recommendation for that individual would be to really monitor how they feel when they move just a little bit. So not pushing their body, not trying to engage in a full-on exercise routine, but if it's safe for them to just move, whether that's a safe walk outside and to enjoy fresh air, or whether that's some movement just in their home space, I think that would be a first step. Anything more towards exercise prescription would really require that coordination between their healthcare provider around restrictions and limitations, and then that clinical exercise physiologist to do some baseline testing to ensure that everything's going to be safe.
Thank you. Next question. Could you provide some more details about the online fitness assessments that you do?
Yeah, that's a great question. So our online fitness assessments, they're obviously slightly adapted from what we were doing in person, but we can still get at most of those kind of core elements of fitness. So we have, instead of a 6-minute walk test, we have a 2-minute up and down time test. We still have a balance test, a flexibility test, and a strength-based test. So those I think are our major ones. So slightly adapted. Oh, and we have a shoulder range of motion as well. So we do it all over the Zoom platform, and it's individual, one-on-one. And so the clinical exercise physiologist is responsible for doing all of the assessments, and it's have the person on camera with them, and so they can really assess and record the information as they're doing it.
Thank you. Next question. How do you deliver an individually tailored exercise program in the group meeting on Zoom?
Yeah, so the way we do that, so we've given people the results, or they've gone through their baseline assessment. So our fitness professionals know who has limitations in the class and who isn't able to do it, as does the moderator. So using those two individuals, they can help individuals recognize where they need to tailor a movement. And that's really the beauty of an exercise program, is we can take any exercise and tailor it. So I can give something to somebody in a seated position that somebody else may be doing upright. And we've had that in our programs where we have people who can't get down to the floor for maybe some of our core work, and so we give them adjustments to do that. And so it's really acknowledging within our group-based setup some of the limitations that we have of different individuals, and then tailoring feedback to them during the program. The actual classes themselves are set up so that individuals are all doing the same variations of exercise at the same time, right? So it's a circuit style. And so that enables us to get everybody set up, and then between the moderator and the lead, but often the moderator go in and make sure people are getting specific feedback if we know they need it. So it might be knees or a different alignment or a version that is easier or harder than what the general one that has been shown. Our instructors are also really well trained to know to give different levels of exercise options, so that individuals can start to learn the choices they can make to tailor things to their needs.
Next question. Approximately what proportion of the participants in this program are older patients 65 and up?
That's a great question, and I don't have all of those numbers. And I don't know, Juliana, if you can speak up if you've got an idea of that, or if we can hear you.
Yeah, so we don't have exact numbers, but most participants are in that 65 and older, well, really around 65 actually, for the most part. And we do have some younger participants that join as well. So it is a bit of a range, but mostly it's around that 65 years.
Thank you.
Thank you. Next question. Did you see an increase in participation for the online programming since COVID started?
Yeah, what we actually saw, so our team flipped really quickly when COVID hit. So by April, we were starting to offer some programs online. And initially, we saw that people were like, oh, maybe we'll just wait till we're back in person. And so we saw a dip immediately. By the fall, we started to see more uptake because people were realizing they didn't have options yet. And so overall, our numbers are a little bit lower, and some of that is because, you know, the healthcare setting has also been drastically changed, so not as many people are finding out about it in those clinical sites. But we're seeing a steadier uptick, I think, as people come into this option. And an important piece, I didn't talk about this, but we have maintenance programs that are after. And so after people complete the initial 12-week program, which is all free, it's all part of a research program, we have a fee-based maintenance offering. And we see really good uptake into that. So once people have this experience and feel the benefits themselves, a lot of them will continue on. Now, that being said, with Excel, you know, as soon as we're able to safely, we'll start to build more of the community-based programs. But there will always be an online component for Excel because we won't be able to have community-based programs everywhere a cancer survivor lives. So we'll always be relying on this online delivery for a portion of our participants for sure.
Great. So you mentioned that you're working on developing French resources for Quebec patients. Would French resources be available for other cancer patients throughout Canada as well?
Yes. Yeah, absolutely. As soon as we have those translational pieces, and especially while it's being delivered fully online, our hope is moving forward that we'll always have a French and an English online version available for anybody across Canada to be able to join into.
So what are some ways that you're able to bring some of the benefits that people get from in-person classes to the online classes?
Sorry, it just glitched out there for me. Can you say that again, Leila?
Oh, sorry. So this question is, what are some of the ways that you can bring some benefits from the in-person classes to your online classes so there's more similarity, I guess, in content delivery?
Yeah, so the actual program delivery is very standardized. So we have a manual of operations and then all the training that we do so that we're fairly confident, even if sites have to tweak things a bit and tailor to their needs. The 12-week progressive program, our educational pieces, the support for behavior change, that's all built in and delivered the same, whether it's in person or online. We do fidelity checks. So we actually go in and watch classes and instructors and make sure that they're hitting the targets that we've got set and the changes in the content that would be necessary across different weeks of the program. And then, you know, we're doing all of the extras, I think, right now for online and continually learning about what we can do more or better to ensure that that is a good alternative for individuals, that we can deliver a really good class, but also a very supportive program and that sense of community, really trying to foster building that.
So you mentioned fee-based maintenance for people after the 12-week program is complete. Are there ways that people can get that covered through their insurance?
Yeah, so if people have the health spending account kind of versions in their healthcare coverage, for sure, that can be covered with the clinical exercise physiologist role in the program. We're doing a lot of advocacy work to see what we can do to remove that as a barrier, and our end goal is to have insurance, healthcare coverage for exercise programs, same as we have as an option to get PT covered or acupuncture or our chiropractic, for example, right? We want exercise to be recognized as a evidence-based, viable, and important health modality that people should be able to get covered.
Okay. So how were you able to get oncologists and other physicians to buy into and promote the program?
That's a really good question. I've been doing this in Alberta for 20 plus years. And so some of it is simply we've built in those clinical contacts. So we have some really great champions, but that is a huge piece of what Juliana and the other hub sites are really working on is that outreach. So how do we increase awareness? How do we show in their understanding and in their kind of terminology, the impact and why exercise should be considered exercise as medicine for our healthcare champions. So we're doing a ton of outreach. We have educational initiatives for them. We've got posters, brochures that we share with all of our healthcare clinical kind of sites to support recruitment. And really, I think our big piece, because we're building that clinical exercise physiologist into the model, we're not asking them to do anything more other than just refer to the program, right? To say exercise is important. And we know when our healthcare provider says exercise is an important part of your cancer journey, your treatment, participants, patients are much more likely to follow through and look up that resource, right? And so for us, having that clinical team member as part of our team, as part of that clinic to community model, is absolutely essential for that. Other things we're doing with different tumor groups, and this will be a bit slower, but we're building in within electronic medical records the ability to refer to our team so that we can do that screening and triage and get them into the right programs. So we're just starting that with a specific neuro-oncology exercise program that'll look at how do we effectively bring that patient population base in through the electronic medical records and referrals.
Great. So do you see this program being expanded to help patients and survivors who are dealing with other chronic illnesses besides cancer?
Yes, I think this is an excellent model, and we've shared it with lots of different groups. Myself, I do work outside of cancer and kidney specifically, and I've got some work with mental health and exercise for depression and anxiety with groups doing fabulous work in that area. So yeah, I mean, there's nothing about the exercise itself that is cancer specific, right? A squat is a squat, going for a walk is going for a walk. We just need to build this in as part of usual care, part of what is important for individuals who are living with a chronic disease. If we can have people gain control of their health by engaging in those healthy lifestyle modifiable behaviors, exercise being one of the big ones, then we can build this in as an approach to chronic disease management and to enhancing wellness and ultimately to reducing costs in the healthcare system because we have a healthier population.
And do you see this program being extended to pediatric cancers as well?
Excellent question. We actually have a large program in pediatric oncology. We've actually just published a series of papers with exercise guidelines and recommendations specific to that population. And in Alberta, we are building out our in-hospital programming, which for now is all going to be online as well. So that pediatric programming and outreach, we'll do some of that under this Excel umbrella as we have the resources to move that forward over the next year. So yes, if whoever's interested in pediatric oncology, happy to have you send me a note. And we've got a network that we've built worldwide. So we've got 160 plus professionals working in exercise oncology and pediatric oncology that have really built the resources that we have over the past year.
That's great. So I think that's it for questions that we have in the chat. I'll just wait a moment if anyone has some last minute ones that they'd like to send in. But I will make sure to send the contact information and things that people need to know in order to get enrolled in the follow-up email that will go out to everybody who's registered for the webinar. So lots of interest in the chat that I'm seeing right now about the program. So that's great. Thank you so much for providing all this information for everybody through this presentation. So I think now's a good time to wrap up. We're just almost at 2 o'clock right now. So thank you again so much to Dr. Nicole Poulos-Reid for that presentation and to Juliana for helping facilitate this as well. We have another webinar coming up next week. So next week is Lymphedema Awareness Week. So we will be having our webinar about lymphedema, and it will be presented by the Lymphedema Association of Ontario. So we'll have Dolores Steinwall and Anne Dimena, who are the president and director of the Lymphedema Association of Ontario. So that will be the topic for next week's webinar. Slides will be available as well as the recording. So those will be sent to your emails as well. And we'll also post it on the website. So everybody should have access to that information. Oh, sorry, we had one more question. Is this available in Ottawa or in areas near Ottawa?
Yeah, so right now, because it's all delivered online, if a participant is eligible, they can absolutely reach out, and then we've got options. We're hopeful that the Northern Ontario hub, which would include Ottawa access, will be delivering some kind of community-specific or site-specific programs. But yes, if anybody's interested right now, it's wide open because of the online nature. Anybody can join in.
Okay, great.
Awesome.
So I think we will end that there. Thank you again so much for today's webinar, and thank you everybody for joining us today. Take care, and we'll see you soon.
Thank you,
Thanks,
everybody.
Layla.
Stay well.
Bye.
Bye.